Hi, today we will be discussing IVF process step by step. So when we talk about IVF process, it has some different steps which everyone needs to understand. Hi, my name is Dr. Wasim Mandrai and my job is to make couples understand how IVF works. So today we will be discussing how step by step IVF is done and what you need to understand during an IVF journey. So when we talk about the IVF, the first and the most important thing is that if you have been married for a year and there is no conception, you should go and visit any fertility doctor or your local gynecologist. And if it continues that there is no conceivance or there is no pregnancy after 2 years, then you should visit a fertility specialist. It's very important to differentiate between a gynecologist and a fertility specialist. So when you go to visit a fertility specialist, first thing is that we do then pre-checkup, where we try to find out where the problem lies. And the most important part in that is that we check the AMH, which kind of gives an idea what is your ovarian reserve. Then the second step is that at the same time we do an ultrasound to check how many follicles are there. Then simultaneously we check the male partner as well, where we do a basic simple test which is called a Semen Analysis test, where we check the sperm concentration, motility, morphology and the progressive motility. So if everything is all right, then we can give some time, more time, and try to have a natural conception or a timed intercourse. But it also depends upon what is your age, because age plays a very important role when we talk about IVF. So once we have undergone the IVF checkup, pre-IVF checkup, and your age is under, let's say, 35 years and you have time, you are not in a hurry, then what we try to do is try to give them the timed intercourse, which I already told, or the minimal stimulation drugs is more kind of a natural, and then we try to wait for some time. If it does not result in any success, then the next step is an IUI, which is basically a very simple process where you will take maybe 2 or 3 injections or hormonal injections to kind of grow that egg. And once this egg grows, and the same time we take the husband's sperm or the partner's sperm, we wash it and then transfer the same sperm back into the wife. If it results in a positive pregnancy, then well and good. If not, then you might have to try for more. So what we do is that we try to repeat the process maybe 2 times, 3 times. But after a certain limit, let's say 4 times you have tried and it doesn't result in any pregnancy, the ultimate thing you can do is go for an IVF. So when you go for an IVF, we have already done most of the pre-IVF checkups, and the second step will be the stimulation. What is a stimulation? It is kind of hormones which we are giving you subcutaneously for about 10 days, let's say, and then when you see the growth of the follicle during these 10 days from both ovaries, and once we have seen this follicle reaching to a particular size, then next step is that we kind of not let them rupture and take them inside the lab. That's where we do the oocyte pickup. Once we have done this oocyte pickup, the next thing is that we kind of give these eggs in a follicular fluid to the lab. The IVF lab is now the most important part in your IVF journey. So what happens inside the IVF lab is that they kind of isolate these eggs, and once they isolate these eggs, they kind of mature it and give them certain conditions where everything remains very good. I mean, controlled environment, good air quality, and whether you have to maintain the pH or whether you have to give the exact nutrition what an egg needs. So after these eggs are being harvested or they are being kept in a certain temperature, we have machines such as incubators. We keep them inside the incubator. Once we have taken these eggs into the incubator, the next step we do is that we wash the sperm of the husband. Once the sperm is washed, the third thing will be the insemination process. Insemination process kind of is like meeting the egg and the sperm. So once we have sperm ready and we have eggs from one side, The next step will be we have to do the insemination. Insemination is of two types. The first one will be more like a natural, which is called as conventional IVF, where we put thousands of highly progressive motile sperms and put them besides the egg and try to help. They try to help them to have natural conception. It is like the sperm automatically is selected by nature. This is the first procedure, which is called a conventional IVF, and at the same time we have the ICSI, which is called as Intracytoplasmic sperm injection. What we do in intracytoplasmic sperm injection is we select a morphologically normal progressive motile, we take it inside a needle, which is called an injecting needle, and hold the egg from the other side and then try to kind of inject this sperm inside the egg. Once this process is done, the second step will be to see the fertilization. So what we do is that the next day we keep them in these conditions in the incubators, and the next day we see the fertilization. After the fertilization check is done, we inform the patients that, let's say we have X number of eggs and X number of zygotes now. That means they have fertilized. And then we wait for day 3 and check on day 3 what is the grade of the embryos. If majority of the embryos are grade A or grade B, then we kind of try to take them to day 5. It also depends upon what is the number of the embryos. When we take them on the day 5, then we have Blastocyst, then also we grade them, and then we update the patient that we have this number of Blastocyst, and we also grade them, and we send an embryo report, and simultaneously we have this process whether we can freeze them or whether we can do a fresh transfer. However, most of the cases are going for this frozen embryo transfer, but there are slight numbers where they will try to go for a fresh transfer depending upon the individuality, where we have some patients everything is normal, they have less number of eggs, less hormonal problem, so then we try to give them a chance in the fresh cycle. However, majority, as I said already, are going for the frozen embryo transfer. When we go for the frozen embryo transfer, it's also very important that the next cycle when comes, when we make this environment where the embryo is being taken, that means the mother's womb, we make it such a good environment that this supports the pregnancy. Then ultimately these embryos which we freeze, we thaw them back, we make them come back to life again, and then we transfer them into the mother's womb. Once the transfer is done, the next step is we give some hormones again in the form of the tablets to support the pregnancy, and once we have let's say 10 to 14 days, we kind of do a Beta-hCG test, which is kind of the confirmation whether it has resulted in a positive pregnancy or whether it has not resulted in a positive pregnancy. However, if there are failed cases, then we try to do the pre-genetic testing as well, which is kind of to check which embryo is genetically normal. So if you have any previous failures, and then we do not want to do the same thing again and again. We just wanted to change a little bit different. And in this cycle, let's say if someone has undergone 2 cycles, then the next cycle we have to do something different, and that difference will be to check genetically the genetic makeup of these embryos, if they are normal or not. If they are normal, then we first give the preference to the normal ones. If they are abnormal, then they are supposed not to be transferred. And once we transfer the normal embryos, at least we are sure that from the embryo side that there should be no problem. Then we can more focus clinically on the mother as well. So all these things are very important before starting an IVF pregnancy, and it's also very important that once it results in a positive pregnancy, then the pregnancy is same as that of the normal. So you don't have to worry that this IVF pregnancy is a little different. Yes, you might have to take a little bit of extra kind of hormones or tablets so that it supports the pregnancy more, because this is a precious pregnancy, and giving this happiness to the couple, it also is an internal happiness to us. So if you are planning for IVF pregnancy, or if you are planning for IVF in the near future, you are welcomed here, and we will try to give you the best. With our facilities, whether it is in the form of the qualified consultants or whether it is in the form of qualified embryologist, or whether our equipments, you will be amazed to find that we have the best in the market right now. Thank you. If you like the video, or if you want more information on this video, you can comment below, and if you need to share it with someone loved and dears, you can share it as well. Have a nice day. Thank you.